Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the venipuncture techniques. Next step is the wash your hands. To draw the blood, position your patient for safety. Sit down, lie down. Note the past history of the fainting or loss of the consciousness. Select the appropriate site and the vein free of the scars. Hematomas, a pulse, the draw techniques could find the site that will be give best blood return. Remember the location order. Palpate the vein with the tip of the finger, differentiating between the vein, tendons, and nerves. Use the tourniquet appropriately. The tourniquet techniques to prevent the inaccurate blood test result do not leave on the longer than 1 minute. Tourniquet may be applied over the clothing for patient comfort. Remove the tourniquet when blood flow is achieved or prior to inserting the last tube. Always remove the tourniquet prior to removing the needle. Next, proper completions of draw. Remove the tourniquet, remove needles and apply safety device while applying the pressure to site. Bandages appropriately. Tend to the safety of your patient. Label the specimen tubes in front of patient. Next, venipuncture technique. Patients and specimen identifications. Complete the computer label. Compare lab's requisition with the patient's information. Important tips. Do not draw from a resistant patient. Do not draw if you are not comfortable. Uncooperative children must receive special care and be restrained for safety. Note patient's reactions. Stop if patients complain of pain. Assess patient. Venipuncture techniques. Factor affecting laboratory value, incorrect specimen handling and storage drawing. Procedure in incorrect alcohol in specimen. Tourniquet on too long. Wrong tubes. Tube not filled to appropriate level will cause the inaccurate test result. Patient factor affecting the lab result. Blood alcohol elevate the result. Diurnal rhythms, RX for daily activity level. Exercise runners anemia chart the change the result. Fasting inaccurate result. Hemolysis destroy the RBC. Heparin incorrect use interferes with the result. Stress increase in WBC. Tourniquet on the too long dilutions. The homo concentration. More challenges. Next is changing the patient. Pediatric. The child, parents or the guardians explain the get down to their level resistant restraints. There are the geriatrics. Physical skin, hearing or vision impaired. Effect of the disease stroke, arthritis, Parkinson's, tremors, dementia, Alzheimer's. Safety issue, wheelchairs balance. More challenges dialysis or cancer patients, fistula and shunts, AV arteriovenous permanent access for dialysis. Long-term care patients, home care or hospital patients, traveling phlebotomists, problem sites, burns, scar, tattoos, damaged veins, sclerosed, thrombosed, edema, swelling due to abnormal accumulations of fluid, hematoma, swelling or mass of blood, and the mastectomy, caution lymph node removal, obesity. Complications or the condition allergies, adhesive or antiseptic latex, excessive bleeding due to medications, hemophilia, fainting, nausea and vomiting, pain while drying, what is normal, what is not, stopping the draw, seizures, convulsions, stop draw immediately, get help. Comprehensive medical assisting, 4th editions, clinical medical. In today's class, I discuss about the various procedure, the procedure for the venipuncture. Thank you for watching.